What is familial hypercholesterolemia and its impact on blood cholesterol? Have you ever wondered why some people have high cholesterol levels despite eating healthy? This brings us to familial hypercholesterolemia, a genetic condition that can significantly affect cholesterol levels in the blood. Familial hypercholesterolemia is an inherited disorder that leads to very high levels of low-density lipoprotein cholesterol, often referred to as bad cholesterol. This happens because the body struggles to remove this type of cholesterol from the bloodstream due to a defect in the liver's receptors. There are two main forms of this condition. The first is known as heterozygous familial hypercholesterolemia, where one parent passes on the defective gene. The second is homozygous familial hypercholesterolemia, where both parents pass the gene. Heterozygous familial hypercholesterolemia is more common, usually resulting in cholesterol levels above 190 milligrams per deciliter in adults and above 160 milligrams per deciliter in children. On the other hand, homozygous familial hypercholesterolemia is rarer and can lead to cholesterol levels exceeding 400 milligrams per deciliter. Individuals with this form often show symptoms in childhood and face a higher risk of early death if not treated. At first, individuals with familial hypercholesterolemia may not notice any symptoms. However, as cholesterol builds up in the body, physical signs can appear. These may include lumps called xanthomas on the skin, especially around the hands, elbows, knees, or tendons like the Achilles tendon. Yellowish patches around the eyes, known as Xanthelasmas, and a white or gray ring around the cornea, called corneal arcus, can also indicate high cholesterol levels. The impact of familial hypercholesterolemia on blood cholesterol is significant. Elevated low-density lipoprotein cholesterol contributes to the buildup of fatty plaques in the arteries, a condition known as atherosclerosis. This process narrows and hardens the arteries, reducing blood flow and increasing the risk of heart attacks, strokes, and other cardiovascular issues, often at a young age. To diagnose familial hypercholesterolemia, healthcare providers typically measure low-density lipoprotein cholesterol levels and review family history for high cholesterol or early heart disease. Genetic testing may also be used to confirm the diagnosis. Treatment usually focuses on lowering low-density lipoprotein cholesterol through medications like statins, lifestyle changes such as diet and exercise, and sometimes more advanced therapies. Early detection and management are essential to minimize the risk of cardiovascular complications associated with familial hypercholesterolemia.